Hi, my name is Michelle Fox. Welcome to my presentation on a cross-cultural assessment of Italy. This is for the class Cultural Diversity, Spirituality, and Ethics in Healthcare. For the purposes of this presentation, I've included a chart showing side-by-side comparisons between Italy and the United States for things like total population, gross national income per capita, life expectancy at birth, probability of dying under the age of 5, probability of dying between 15 and 60, total expenditure on health per capita, and total expenditure on health as a percentage of GDP. We've all studied the Roman Empire in our history books in grade school, but the modern country of Italy was born in 1861, which followed a successful revolution to separate Tuscany, Modena, Parma, Bologna, Romagna, Lombardy, and Venetia from the Austrian Empire. Officially, the language of Italy is Italian, but there are over 30 distinct dialects. Roman Catholicism has a huge presence in Italy, but the other faiths are Jewish, Hindi, Buddhist, and some folk beliefs where they practice spells like making birds stay out of a newly planted field, making warts disappear, and even a spell to make dogs go away. When it comes to higher education, unfortunately, only 22% of Italians aged 25 to 34 seek a higher education. When it comes to occupations and trades in Italy, the largest group of working people is between 45 and 59. The population excels in engineering and metallurgy. I especially appreciate their metallurgy in the Lamborghini and Ferrari categories. They also export large amounts of olive oil, tomatoes, and rice, but they import much of their meats. Despite the need to import raw materials, the chemical sector is very active, and textiles make up one of Italy's largest industries. The agricultural industry is larger in the southern half than it is in the northern portion of the country. In addition to folk beliefs and spells to keep birds out of a newly planted field, a large portion of the Italian population practices self-medication. This is problematic at times because up to 2/3 of those cases result in inappropriate self-medication practices. So as a cross-cultural nurse, you would find a great need for patient education on medication administration in Italy. As a country, the Italian healthcare system is based on the belief that every citizen should have access to healthcare and that the system covers all needed procedures. The access to healthcare is admirable, but there are some weaknesses. There are studies that show that med discrepancies happen in 92 out of every 366 patients, with the most common discrepancy being an omission of a prescribed medication during hand-up when a patient transfers from one level of care to another. As far as ranking the healthcare system of Italy globally, it depends on the source you read. The Italian healthcare system is ranked differently depending on which source one looks at. For instance, the World Health Organization and US News and World Report both rank Italy second in the world, only behind France. However, according to the Legatum Institute's Prosperity Index, Italy's healthcare system was not even ranked among the top 13 countries globally. In summary, if one was to be an American nurse and go to Italy and need to give nursing care in their culture, there would be a great need for counseling and teaching and self-medication. There's a need for assessing for their beliefs and what kind of folk spells and things they use for the rural patients. And there's also a need for better handoff techniques from one level of care to another so that medical errors and omissions can be reduced. Thank you for paying attention to my presentation on Italy.